Well, good afternoon. Happy Visakhi to the Sikh community today. We wish you all the best. I know for many of you, Easter looked a little different this year, but I hope you found ways to connect with family and friends while doing your part to stay at home. I want to say thank you to everyone who worked this long weekend, our heroes on the front lines, in the healthcare sector, in grocery stores and pharmacies, and all other essential services. On behalf of everyone in this province, thank you. I want to recognize our developmental services workers looking after those in group homes. It's heartbreaking to hear stories like what happened at Participation House in Markham. Minister Smith's team has been working around the clock to help. And I know that Minister Calandra has been working directly with the CEO of Markham Stouffville Hospital to address the situation. And I have to thank Dr. Jane Philpott for putting on the scrubs and coming back to the front line. Thank you, Jane. My friends, we all recognize how hard it is to be working on the front lines right now. I know that it takes a tremendous strain on people. But we have to look after the most vulnerable. We have a duty to take care of those who cannot look after themselves. We need to stick together. We need to stay the course. And I know it's difficult, but this virus is ruthless and is deadly. Our frontline heroes have our backs, and we must have theirs. And that means giving them the tools they need. This is something I've been laser focused on, and we're making progress in procuring critical medical supplies and equipment to back up our frontline workers. We now have masks, gloves, and ventilators. And over the past 5 days, we've acquired more than 13 million surgical masks, including a shipment of over 7 million masks this morning. 200,095 masks and 38 ventilators, with much more on the way. And over the past few weeks, we've shipped supplies to more than 650 organizations needing supplies across the province. In fact, this weekend, for every long-term care facility that requested PPE, we acted immediately, and most supplies were delivered within 24 hours. This weekend alone, we delivered over 6.5 million surgical masks to hospitals, long-term care homes, and retirement homes across the province. We're getting thousands of donations every day, thousands of offers to help from grassroots organizations like Conquer COVID-19, from institutions like Queen's Universities, where students and researchers who are working hard to invent and build a low-cost ventilator, from people who just want to do the right thing, like the anonymous donation of 3,500 masks and 20 cases of hand sanitizer dropped off at Minister Clark's constituency office in Brockville. But there's still much more to be done. As Canadians, we need to have each other's backs. And our neighbors in Alberta have committed to ship a generous donation of supplies and equipment. That includes 250,095 masks, 2.5 million procedural masks, 15 million gloves, 87,000 goggles, and 50 ventilators. I want to thank my good friend, Premier Jason Kenney, and the people of Alberta for this generous donation. By standing together, united, by being part of Team Canada, because I've seen what we can do when we come together in the face of adversity. We always answer the call. We're always ready to help. And this pandemic is no exception. Thank you, and God bless the people of Ontario. I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Protecting the health and safety of frontline workers and the patients they care for, as well as our first responders, is our top priority. Based on the advice of the Chief Medical Officer of Health and the experts at the COVID-19 command table, our government has taken decisive steps to stop the spread of the virus, included ensuring the continued supply of personal protective equipment. From the start of the COVID-19 outbreak, we have contended with a constrained global supply chain. However, in the face of this persistent challenge, we have made considerable progress in securing personal protective equipment. We have done so by leaving no stone unturned. We continue to work with traditional suppliers. There have been more than 7,500 emergency supply submissions that have generated nearly $90 million in purchases of supplies. And working with our federal partners, Ontario was able to procure larger supplies of equipment and goods at better prices. We're also working with local manufacturers and businesses who have answered our call for help. For example, O2 Medical Technologies, with the support of Ontario's manufacturing sector, is building 10,000 ventilators. Finally, we are fortunate to have so many great businesses who call Ontario home, who've donated everything from hand sanitizer to gowns and masks. The number of donated supplies and equipment is in the millions. Ontario Power Generation donated 500,000 surgical masks. Home Depot donated 20,000 N95 respirators, and CafuLink International Service Corp donated 1,250 gowns. Others, including mining companies like Baffinland, as well as dentists and veterinarians, have also come forward with donations of vital supplies and equipment. The generosity of these organizations truly represents the best of the Ontario spirit. Thank you. To ensure that supplies and equipment are expedited to those most in need, Ontario is providing same-day deliveries to hospitals, long-term care and retirement homes, and other facilities to support essential workers in all settings. We have sent supplies to over 650 organizations to support frontline providers, and over the past weekend delivered 6.5 million masks to high-priority providers in need. We continue to assess all areas of the healthcare system to determine where additional capacity may be required and how to deploy available resources to these areas. We are doing whatever we can to support the incredible work being done by our frontline healthcare providers during these extraordinary times. And we will continue working as hard as we can to add to our inventory, expand our health system capacity, and be equipped to fight this outbreak. In the meantime, we continue to ask Ontarians to please stay at home to reduce their exposure to other people. Everyone has a role to play in stopping the spread of COVID-19. The lives of many Ontarians, especially our community's most vulnerable citizens, are in your hands. Please continue to stay home. Thank you.
I guess before we start the questions, I just want to wish my Deputy Premier and Minister of Health a very happy birthday today. Saying it's a difficult time to celebrate a birthday, but Deputy Premier, again, happy birthday. I should say happy 30th birthday. We'll take questions now.
Go to the phone line now. First question.
First question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier, and happy birthday to the Deputy Premier. I just wanted to ask, I know the House is coming back tomorrow for, I guess, an expedited afternoon session. I'm just wondering, what are you hoping to achieve, and what will the protocols be in place at Queen's Park tomorrow?
Well, the one is to extend the Emergency Act for another 28 days. And then we have, I think it's 5 items, 2 with municipal housing, 3 on education, falls under childcare as well. So one bill is going to consist of about five different items there, but hopefully we'll get through this. And I just want to thank members of the opposition for their cooperation on getting these passed right away.
And so, Premier, does that mean that after tomorrow we will know if schools will be returning on May 4th, or is it starting to seem like schools will not be coming back this year?
Well, we wouldn't be able to answer that right now, Robert. It's a little premature. You know, again, we're seeing a glimmer of light at the end of the tunnel here, but still, we're going to take the advice off the Chief Medical Officer and our, and our health team.
Next question.
Next question comes from Travis Donrush from the Global News. Please go ahead.
Hi there, Premier, and
Hi,
happy birthday, Minister Elliott. This question is about long-term care. There are now 22 residents dead at Seven Oaks. Nearly half of the residents at Pinecrest and Bobcaygeon have died, and we're approaching 100 outbreaks at long-term care facilities. You just said that you have a duty to protect the province's most vulnerable. Do you think you've done that, and how would you characterize the government's response, a success or a failure?
Well, it's very, very tough, Travis. We've put an iron ring around long-term care. We're putting all the resources that we have available to long-term care and doing absolutely everything possible that we can. We're doing all testing. We're testing all patients. We're testing all frontline healthcare workers. I confirmed that with the CEO of Ontario Health, Matt Anderson. They're putting a full-out blitz onto that, and they're the most vulnerable. They're the most vulnerable in society, and we're doing everything we can to make sure that we slow the spread until it doesn't get inside these long-term care homes, and it affects everyone. You know, everyone has a grandparent or a friend or a family member somewhere that knows someone in long-term care. I speak from experience. You know, as I said before, my mother-in-law is over at West Park, and it breaks my heart watching Carla stand outside the window in tears. And there's hundreds of thousands of families in the same position, wishing they could jump in there and help their loved one in there. It's very, very difficult for families right now. Very difficult, and especially when you want to help a loved one. As Carla said, put me in a hazmat suit, do anything. I got to help my mother, and I've heard this story over and over again. It's heart-wrenching, but we have to rely on our medical professionals, our caregivers in there, which are an absolutely incredible, unique group to be doing what they're doing every day, showing up, you know, holding their post per se, and getting through this. So it's a very difficult situation right now, Travis.
Premier, just back to my initial question, with more than 100 seniors dead, though, do you think that there have been failures?
Well, again, we could look backwards and point out every single little item. I'm sure there's areas in this whole pandemic that could have, should have, would have, and I feel we're doing everything we can right now, putting the resources. We delivered millions of items to long-term care homes over the weekend, and we're doing everything we can. I can't point out one particular item you could have done better or we did worse. We're doing everything we can on long-term care right now, and you could look in hindsight right from the get-go of this. Could we did a lot of things differently? I'm sure we could point out quite a few different areas, but what are we doing to move forward to make sure we protect these people? And it's all hands on deck. We're doing everything we possibly can to make sure we keep the most vulnerable safe.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, you've said that we've got to get the equipment and do everything we can, but Ontario still lags when it comes to testing. I wonder if you can tell us, I know you're saying 13,000 by next month. That seems like a long time. Mm-hmm. What's slowing it down? Is it a lack of testing equipment, a lack of lab capacity? And if you could, we got this Spartan Bioscience
Yeah.
test approved by Health Canada, although it took weeks
Yeah.
for that to happen. That was approved over the weekend. Another company in Markham got told no, even though it's being used in the U.S., the U.K., and continental Europe. So is a lack of testing equipment holding you back? Is it the labs? Is it the Health Canada bureaucrats slowing things down? What is it?
Well, I think we're just slightly under 6,000 yesterday. Our goal is to hit 8,000 by the 15th of April. They're telling me they're on target, and it's not from a lack of anything. We have everything in place. It's frustrating. That's what I can tell you. Very frustrating. You have to understand, and the people at home, we have to separate the elected officials versus chief medical officer, kind of a standalone area. And I've always said I'm not a medical doctor, but it doesn't take a rocket scientist to figure out the more people we test, the quicker we're going to put an end to this. And Brian, if you're asking if I'm frustrated, I'm frustrated, to say the least. But I have to rely on the medical professionals. And again, I'm not a doctor, and we have everything. We have everything available that we need to get these tests done. And they told me 8,000. Well, on April 15th, I want to see 8,000. And I think it was on the 25th or 26th, 14,000, and so on and so forth. But let's just get out there and test everyone. They've given me their word. They're going to test every single long-term care resident and every single health worker at long-term care. That's the first step. We have to do the seniors. And again, I'm sold on making sure we get the frontline healthcare workers that are in the area, especially of COVID or emergency rooms or anything along that area. They should be getting tested. And I think with the Spartan units, we can get results within the hour. So that's really going to help out, that, especially on the frontline healthcare workers and right across the board. And our first responders, we can get a result in an hour. Well, we might have to be testing people every second, third day in those positions, because I understand the science to a certain degree that we could test someone, and a day later, they could be infected, or they could have been infected when we tested them, and it doesn't show up for 2 or 3 days. I understand that, but still, it's better to test than not test. And I can't disagree with what you're saying, Brian. But again, I have to follow the advice from the chief medical officer and the health team. I have to.
Premier, we've got 734 deaths in Canada. Dr. Tam, at the federal update about an hour ago, was saying roughly half of them are in long-term care facilities. I'm wondering, is there a way to focus that testing on long-term care to strengthen that iron ring you talk about and open up the rest of the economy? Because if most of the problem is in long-term care, why do we end up shutting down the whole province? You've just extended the emergency orders for another 28 days. That takes us to May 12th. Will we have to go beyond that, or can we, if we're testing enough in long-term care facilities, start letting people get back to work?
Brian, I've heard that argument so many times over the last few days. There's a few parts to that. First of all, again, I have to go back until we get the green light from the chief medical officer to start moving forward. I heard the example of Ottawa over the weekend by one of my ministers, saying there's 3 people in ICU in all of Ottawa, and you're shutting down all of Ottawa. But you just can't flick the lights on. We just can't flick it on, open the gates, and just start. We just can't. We aren't ready yet. Until we see some modeling that the curve goes down, then we do trickles opposed to just opening things up. But I hear it. I hear what you're saying. When we go out there and they do some focus polling, and they asked people the number one concern over the virus, over anything, is the economy with people. They want to find out how they're going to put food on the table, how they're going to pay rent, how they're going to pay a mortgage. That's their number one by far over anything. Number two is people are just getting restless. They're getting squirrely staying inside the house. And I know it's difficult, but that's why we see a little glimmer of hope, a little light at the end of the table. My biggest fear is all of a sudden we get another wave and it hits us. I just want to make sure we do it properly, cautiously, and not just jump into this and just open up the floodgates. It just, I think it'd be irresponsible. But we do have a team together, and what I'm going to do, I'm going to pass it over to my Minister of Finance. He shows up every single day. But there's one thing that this tells me, and I've said this from the day I got elected: people are special in Ontario. They're workers. You know, they're just workers. They want to work. They want to get out there and keep moving forward. And that's a real positive thing. But again, we're going to be extremely cautious. So I'm going to pass over to the Minister of Finance that's putting together the plan on the economy and the recovery after COVID.
Thank you, Premier, and thank you, Brian. So this is the work now that is a part of what the Cabinet Committee the Premier created last week is working on. It's not just the work, though, of a bunch of Cabinet ministers, although it is very important. They're very important members of that team. We're going to be reaching out for suggestions and ideas, listening to feedback from across the province. As the Premier noted, the recovery could be happening prospectively in different places at different times once we get the go-ahead from our health officials. It could be in different sectors at different times, depending on what changes can be made in terms of physical distancing. And of course, this very important issue that's already been talked about today about testing, as well as eventually determining what the actual penetration of this virus is in terms of the Ontario population as to when it will be safe. But I have to emphasize that, as the Premier has said, as the Minister of Health has said, the good news that we hope we will get is because of the physical distancing, because of what people have been doing, the collaboration and cooperation of Ontario employers and workers and families and all the great things, the ways people celebrated Easter and Passover separately this weekend in a different way. But that's what will be the very important first step. But absolutely, at the Premier's direction, that work is going on right now. We will, of course, be working very closely with our medical team to understand, and with different medical health officers in different areas to understand where the opportunities are. And when it's safe, we will have the plan in place to get the economy back on its feet as soon as possible.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi there, Premier. Just wanted to tell you something we heard today from the family of a resident in a long-term care home in Toronto. They received a recorded call from the management of the home informing them that there were 14 deaths at the home and a large number of infections. I just wanted to know what's your reaction to the fact that families are receiving this news as a recorded phone message, and that this particular home seems to have gone from not having a serious problem to all of a sudden telling people, the residents, that there are the families of the residents, that there are 14 dead?
Well, Mike, maybe offline we could chat and I can find out which home it is. That's tough to hear. You get a recorded message, and I can't speak on behalf of the home. I don't know their situation, if they're that strapped on personnel that they can't make some personal phone calls. I don't know what the size of this home is and if they have their resources, but that's the first time I've heard of a recorded message. That's, again, I don't want to knock the home because I don't know their situation, but I don't know, it kind of seems cold. If possible, even if they need the support, maybe we can get some folks here at the Ministry of Health to help out making the phone calls. I don't know. I wouldn't leave a recorded message like that. But again, I don't want to knock these folks. they're working around the clock. They're just strapped for resources and help. And so I wouldn't want to talk negatively about some great people that are doing their best. But if they need their help, maybe we'll be able to help make the phone calls at the ministry.
Hey, thanks, Premier. And if I could follow up, a slightly different question related to long-term care. Every day now we are hearing of new deaths being reported at long-term care homes. And from everything I've heard from the scientists and the medical professionals who follow this, someone who's dying today in a long-term care home was infected probably 2 weeks, at most 3 weeks ago, which means that they were infected after the province imposed the state of emergency. Have you been able to get any answers as to why infections were allowed to get into long-term care homes after you announced the strict measures restricting access to long-term care homes?
Well, what I'll do, Mike, I'll pass it over to the Minister of Health. She'll be able to answer that.
Well, I think that the part of the explanation is that some of the workers were working in 2 or 3 different care settings, and they inadvertently brought the virus into the homes. The Chief Medical Officer of Health has strongly recommended that people only work in one facility with the hope that they will be able to increase their hours, because I know for some people it's an economic necessity for them to work in 2 or 3 homes where they put together enough part-time hours to make a full-time job. But that has been strongly recommended by the Chief Medical Officer. And we're also looking at making sure that the workers who work with the patients who may have COVID-19 symptoms, who are being socially isolated, that the same workers work with them, and that other workers work with well patients, so you don't mix the staff up, so that you can keep that separate. So there's still, we're still learning things, we're still implementing measures, but the other issue is completely restricting guests, that at first people were just screened. Now they're not able to come in, nor are delivery people unless they're thoroughly, the delivery people are thoroughly screened. Unfortunately, family members cannot, and I know it is heartbreaking for many family members knowing that their parents or loved ones are there, but we really do have to make sure that we protect these very, very vulnerable people.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Colin.
Hi, Premier. You said just earlier that you wanted to be cautious and responsible when it comes to restricting some of the physical distancing restrictions. So Ontario right now looks like it's been doing a pretty good job in terms of flattening the curve. If you look at hospitals, there isn't that overwhelming surge that we were expecting to see last week and this week. So what specific criteria is your command table looking for before determining that, okay, it's time that we can at least in part start lifting some of these restrictions?
Well, I guess we're going to be putting out some modeling over the next short while, and we'll be able to get the exact time. And that will really determine which way we go. And again, I want to be cautiously optimistic, but I just don't want to think, okay, people to think this is done, we're just moving forward. And no, even when the economy turns on a little bit, there's still going to be people with COVID-19, and there's still going to be deaths. It's a very happy balance. Like it's difficult. There's going to be risk. Even if we turn it on a trickle, there's going to be a risk. And I do not want to just jump into this. I want to be very, very cautious and take the full advice of our medical team and along with our chief medical officer. And as the finance minister was saying, we need to consult with the industries too, no matter what industry, be it construction or other industries, that they feel comfortable. I do not want to just turn this on full tilt. We can't. We just can't until we get clearance. And then we have to consult with communities. We have to consult with sectors. So, we'll do it, but we'll do it cautiously and not for the next little while that I can see until we can see more favorable numbers. But in saying that, Colin, you're right. I'm hearing it. It's ramping up more and more. I've been hearing it the last few days from everywhere across Ontario. People are getting a little antsy, and they're concerned about how they're going to start paying the bills. I appreciate their concern.
Thank you, Premier. And I just had a question for the Health Minister.
Yep.
Minister, so it seems like hospitals, as I just mentioned, are in good position right now. The number of available ICU beds is outnumbering the patients who have COVID-19, at least in hospitals. But as we know, the largest number of deaths has been in long-term care homes, I believe 119 as of today. Some patients are housed 4 to a room. They're cramped. They don't have a lot of space to go. Should the province be moving more elderly COVID-19 patients from long-term care homes to those empty hospital beds if we can make that connection? And also just happy birthday, by the way.
Thank you. Well, what we're trying to do is make sure that we can, in long-term care homes, if people need to be socially isolated, be able to do that. But as you say, there are some homes where there are 4 residents in one room, and they don't have the physical capacity to be able to move people around. So we are looking at other options where we can move people to safer places to stay. Of course, they would need to be tested before they're moved to a retirement home, for example, or a hospital. Of course, they would still need to be tested upon coming in to determine and then be socially isolated again. But we want to make sure that we're going to have the space in our hospitals too, in case there is a peak, in case the numbers spike again. While they have been going down for the last 4 days, they went up a little bit today. However, we can't sit back and be complacent about this. There are many more things that could happen, and we need to make sure that we continue to have the available hospital space, the number of ventilators that we may need. But of course, we want to make sure that people that are in long-term care homes that do need to be socially isolated can be. So hospitals are one of the solutions. And of course, if they need to be hospitalized, of course they will be.
Next question.
Next question comes from Cynthia Milliken from City TV. Please go ahead.
Hello, this is for Premier Ford, please. Hello, Premier.
Hi, Cynthia.
Hello. You were saying earlier, Premier, that everything that needs to be done and could be done to protect seniors in long-term care is being done. However, in BC, for example, they have made it law that a worker can only be in one long-term care home. Now, the problem is they're not making a lot of money, roughly $15 an hour. They're not given full-time hours, as Minister Elliott noted. Should you reorganize the whole system, make it law so that they can only be in one long-term care home? It's pretty obvious, and don't you think this should have been easy to recognize from the get-go that this is how it would be spreading in long-term care homes?
Well, we have to look at the resources too, but I agree. You can't be jumping from home to home, and they're doing it because they need to make a little more money. And I'm going to pass this right after I speak over the finance minister on this. But we fully understand they have to earn more money. But the resources, all of a sudden, we take thousands of frontline healthcare workers out of the system, stick them at one home. And how about all the other places they worked? How do you fill those gaps as well? Because there's going to be gaps if we start requiring that. But I'm going to rely on our health team to come up with that recommendation. But it sounds like common sense. You don't want people going from home to home to home. But on the making sure that we top them up on the wages. There is a program right now with the feds that we're looking at, and I'm going to pass it over to the Minister of Finance to talk about that.
Thank you, Premier, and thanks, Cynthia, for the question. So as the Minister mentioned, Minister of Health mentioned, there has been direction from the Chief Medical Officer now around strong advice around not moving from home to home. Part of this is the system. The system is quite widely distributed. You're talking about retirement homes and long-term care homes, the majority of the retirement homes being private homes that operate. So we've provided, or the Chief Medical Officer has provided that direction, and certainly we continue to look, as the Premier has said, at whatever options could be on the table in terms of trying to lessen the spread. Unfortunately, this issue with long-term care homes is also, when we step back and look globally, where so many of the issues have happened in different jurisdictions, because the elderly are that very vulnerable population. So in addition to that, we're also looking at what's being done elsewhere. But unfortunately, and very sadly and tragically, this has been part of the trend internationally in terms of the people that are vulnerable, and of course we will do everything we can to protect them.
Thank you. And my second question is for Premier Ford as well, please.
Yeah.
Premier, the numbers are looking good, that you've referenced that. For example, in the modeling that was released a week and a bit ago, it predicted by this day there would be 1,000 people in long-term care. Right now we have about 267, I believe, 260 actually. So when you see those numbers, first of all, when can we expect the new modeling? And how do you keep people on board? For example, yesterday I saw on Twitter there was a very small protest in Vancouver, but it was a bunch of people defiantly saying, don't drink the Kool-Aid, don't listen to the government, we should be allowed to be outside on a nice day.
Well, the reason we're at the numbers we're at right now is because of the great work of the residents of Ontario. Everyone pitched in, vast majority of everyone was listening. And keep in mind, BC's a little ahead of us, so they're starting to see a downward slope when it comes to the curve. And I've had many conversations with Premier Horgan, and he's doing a great job out there as well. But we just have to hang in there a little bit until we don't jump the gun. I know everyone's getting antsy. I see it and I hear it. People want to get out there, but what happens with we do that and all of a sudden this comes back and bites us in the backside and just comes back with vengeance, or another wave comes through. I'd rather be safe than sorry. I want to be cautious, and I understand. I fully understand people are getting anxious, but we can't move until we see a difference in the curve. And yes, as Minister of Health just mentioned, yeah, we saw a little downward slope and then it jumped up slightly, but we'll have a better idea over the next, I guess this week, we'll have a lot of material to measure and send out for the modeling, but I'll leave that up to the health table, and that question will be asked to them today until tomorrow when I come out. I'll have a date where we can look at more modeling. But Cynthia, I hear you. I just want to be safe. That's all. I just want to make sure we protect the people of Ontario and we don't jump the gun on this. Everyone's like, at the gate, ready to let those, doors open, like at the horse races, and everyone wants to take off. We just can't right now. We have to go through this for a little bit longer. As painful as it is to everyone, we just have to do it. And when the time is right, we will open it up slowly but surely. And but we'll do it cautiously too. It just makes me nervous just to move forward rapidly. We just can't do that.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there, Premier.
Hi, Laura.
You keep saying that every patient in long-term care and every worker is going to get tested, and that's just not the case. That is not what your own guidelines are saying. So why do you keep saying that, and will you call your Chief Medical Health Officer to actually change the guidelines for long-term care to say that when there is an outbreak in a home, that every single person in that home should get tested, because that is just not the case right now?
Yeah, Laura, that was a conversation I had over the weekend, again, with the CEO of Ontario Health that sits at the table. He told me that he's going to be proactive and test everyone. I have to take him for his word. I understand maybe that's not what's being said over at the table, but we'll make sure it's very clear to get it done. And I got to take his word for it. When he tells me he's going to do it, you know, we're going to see the numbers. Either it's going to get done or it's not going to get done, and hopefully it's going to get done. But we'll start measuring. And see, I can't manage anything. I'm a numbers guy. And unless I see numbers, you can't manage unless you measure. And I've been saying it over and over again. Let's see the measurements. Let's see the modeling. I want to see how many people are tested. I want to see every single long-term care home resident and health worker there tested. And he's agreed that they're going to get it done. Laura, believe me, I get frustrated just like everyone else. And just get these damn tests done. Simple. I don't know what takes so long and what's so hard about it. And they said they're going to do it. So over the next couple days, let's see the results.
Follow up?
Thank you. And just on a follow-up, Premier, if we aren't seeing the numbers that we anticipated in hospitals right now, is it possible to redirect some of the workers there to these long-term care facilities in places like Participation House, which has said over the weekend they still have a critical shortage of staff, 6 people for 42 residents. We know that some long-term care facilities are struggling with maintaining the care for the residents, and then they're getting sick as well. So will you consider, are you going to send some of the people who are nurses, doctors who are in hospitals right now, who maybe aren't seeing the numbers of COVID-19 outbreaks that were anticipated, redirect them immediately to these long-term care facilities?
Well, I'll pass it over to the Minister of Health, but I had a good conversation with Mayor Scarpitti yesterday, and I was on the phone numerous times with Minister Smith, and they're going to put the resources in that are needed, because it's not fair to the few people there trying to, you know, take care of everyone, and especially the people that are living there. It's just not fair. They can't help themselves. That's what breaks my heart. They can't help themselves. We have to go there and put the resources in. And I said to Minister Smith, whatever it takes, I don't care, whatever it takes, make sure we get people in there to support Participation House. And I know they've been in, Minister Klander has been in contact with the hospital there as well, Markham Stouffville, and we'll get an update, but I'll pass this over to Minister of Health.
Well, we've also received thousands of applications from healthcare workers through our workforce matching portal that was opened several days ago, and a lot of those applications are coming from nurses who've retired, from medical students, from people who've been trained in other jurisdictions. So we are reviewing the qualifications right now for retired nurses. It's working with the regulatory colleges to have their credentials recertified. So this is a whole new workforce that's being matched with employers. A lot of them are long-term care homes and retirement homes, and they're being matched geographically wherever the need is to get more people in there to help out. We also know that there are other congregate living spaces like community living homes and so on. As the Premier said, we're working with Minister Smith to make sure that we get the people that are needed there. So there is a whole other workforce out there that is ready, willing, and able to become involved without actually even needing to take people from our hospitals, because there are still many people there that are needing the care. But with these additional people, we will be able to provide the support that they need in these other locations.
Okay, that's all the time we have for today.
Thank you, everyone.